Testing 1, 2, 3. Testing 1, 2, 3. Is that too high for you? Testing 1, 2, 3. Testing 1, 2, 3. All right.
Check this one. Testing 1, 2, 3.
Perfect. Thank you. Testing 1, 2, 3. Testing 1, 2, 3. Testing 1, 2, 3, 4, 5, 6. Testing 1, 2, 3. Testing 1, 2, 3, 4, 5, 6.
Excuse me. Thank you all for being here. Hearing will come to order. I'd like to welcome members of the subcommittee and our witnesses and guests today. Thank you. Before I get started, I'd like to welcome Mr. Dole, who is joining the subcommittee for the first time, as well as Mr. Brady, who has returned to the subcommittee. We're glad that you all could join us. Earlier this year, our first subcommittee hearing, I made a commitment to the disability community to make this program work better and to promise opportunity for those who want and can return to work. I'm talking with the disability community, and what I often hear is that in order to make this program work better and take away some of the fear, the reluctance of those trying to return to work, Congress needs to do something about overpayments. Now, overpayments happen when Social Security pays a beneficiary too much, sometimes through no fault of the individual. I bet all our offices have had to work with folks who experience overpayments, and these stories tend to spread like wildfire throughout the community. Why would you try to return to work when you hear of others who have done it and yet end up owing thousands of dollars to Social Security due to overpayment benefits? Today we'll hear from the Social Security Administration and the Government Accountability Office about how complexity of the disability program hurts both beneficiaries and taxpayers. According to the GAO's testimony, more than half of overpayments in the last 10 years were due to work activity. That's a symptom of a broken system. The leading cause of overpayments in the disability insurance program is due to the complex work rules, which are difficult and costly to administer, and the end result is bad for individuals with disabilities and taxpayers. Just take a look at the chart that's on the screen now. Social Security provided us. No wonder beneficiaries can't make heads or tails of this system. Maybe y'all can understand the chart. This is what the folks who want to work have to go through so they don't face financial risk down the road. Individuals are responsible for reporting their wages to Social Security so that benefits can be properly adjusted. Unfortunately, the system for reporting wages is not user-friendly for the worker, and it's unreliable. For those who try to return to work, beneficiaries simply don't have an easy way to report their earnings. They must go in person to a field office to talk to someone on the phone or mail in proof of earnings. Yet in the Supplemental Social Security Income Program, Social Security actually has modern options for wage reporting, including a smartphone app. Social Security needs to find ways to make reporting earnings easier for everyone. And for those people who try to do the right thing and report their earnings, they can still face overpayments. The program is simply so complicated that it can take Social Security several months to make sure a person's benefit check is correct. Right now, the reality is that Social Security sends the wrong message. If you go back to work, you may get hit with a major overpayment from Social Security through no fault of your own. And that's wrong, and we need to put an end to that. We need to make sure that the disability system encourages people to work and makes it easy as possible for them to do so. We can't have a system that punishes them for doing it. So it's time to do better for individuals with disabilities. I thank our witnesses for being here today and look forward to your testimony. I now recognize the ranking member, Mr. Becerra, for his opening statement.
Mr. Chairman, thank you. Whoa. There we go. No, still.
It's yours.
It's mine, right?
You want to use mine?
Yeah, that's. Thank you. Let's see if that works better. Chairman, thank you first very much for calling this hearing. Thank you to our witnesses for their testimony in advance. How we help the Social Security Administration avoid overpayments and support disabled Americans who receive Social Security disability insurance but yet try to return to work is something we want to encourage. In spite of their severe disabilities, the fact that they wish to try to go back to work is something that we should support. Remembering that all of these disability insurance recipients earn those benefits because they paid into Social Security while they had the opportunity to work, most for more than 20 years. On average, about 22 years of work goes into the services that some of these disabled Americans now have put into the American public in terms of the workforce over the years. And so these are folks who have put in quite a bit of time before they became disabled. But at the same time, we have to recognize that these are folks who, on average, are in far more difficult health condition than most Americans. 1/5 of men who receive disability insurance die within 5 years of starting to receive those disability insurance payments. 1/6 of women die within 5 years after they have begun to receive those disability insurance benefits. The vast majority of these disability insurance recipients are over the age of 50. Over a fourth of them are over the age of 60. And so if we remember that you don't qualify for disability insurance unless you can't work, not just at the job you used to do, but any work. You may have been a rocket scientist before you became disabled, but if you can't do even the most menial of labors, you still will not receive disability insurance. You have to be prepared to do any type of work that is out there that pays. And so it's very difficult to qualify for disability insurance. And even when you do receive it, on average, you're getting somewhere around $1,100 a month, which leaves most people in poverty if they have nothing else to go with. But yet, despite all these odds, many Americans would like to try to go back to work, if at all possible, even with their disability. The Social Security benefits that folks receive don't replace, as I said, a lot of the income they used to have. On average, they receive less than half of what they used to make when they were working. More than a fourth of those people who attempt to return to work ultimately are not able, only a fourth of them who do attempt to work are able to do so. Strike that. Let me start that again. A fourth of those Americans who are on disability insurance benefits try to work.
Is that a quarter?
Yeah, about a quarter, Mr. Chairman. They try to work. The difficulty is this. Only a small fraction of those Americans who are disabled who try to work ultimately succeed in sustaining themselves in work. As a result of the efforts of many of these Americans to try to go back to work, Congress enacted some protections to make sure that if you try to go back to work, you land a job on day one, you don't lose your benefits, your disability benefits. We want you to know that you can try to take that risk of returning to work without suffering both the loss of your disability insurance benefits immediately and then possibly the loss of the job soon thereafter if you can't sustain it. And so we instituted some protections a while ago to make sure we gave Americans who are disabled the incentive to try to go back to work. Those work incentives have encouraged a number of disabled Americans to go back and see if they can make it happen and go back to work. Part of those protections include things like making sure that we offset the fact that it costs more for someone who's very disabled to return to work, whether it's because you need a wheelchair or an accommodation at the work site. There are additional costs that are involved that we don't want the fact that there are higher costs to work as a disincentive for any employer to hire you or for you to believe you can't sustain it because you'll have additional costs. We also allow beneficiaries to first test their ability to sustain work and support themselves before we have them lose their eligibility for the Social Security disability insurance benefits and their health care. That's a big encouragement because if you're going to lose your benefits, you're in trouble. And so, Mr. Chairman, I think what we're trying to do is make sure that we do this the right way for Americans who are disabled. Let them test the ability to go to work. Keep the protections there that give them every incentive to go to work. At the same time, making sure that we don't, in the process of trying to streamline that bureaucracy that you showed there that causes, in some cases, overpayments to go to people who should not have received that money, from causing those who really want to get out there and work that opportunity to do so. So, Mr. Chairman, this is a good time to have this hearing. I look forward to the testimony of the witnesses, and I look forward to all the discussion. With that, I yield back.
Thank you. As is customary, any member is welcome to submit a statement for the hearing. And before we move on to our testimony, I want to remind our witnesses to please limit your oral statements to 5 minutes. However, without objection, all the written testimony will be made part of the hearing record. We have one witness panel here today, and at the table are David A. Weaver, Associate Commissioner, Office of Research, Demonstration, and Employment Support, Social Security Administration. It's a mouthful. Daniel Bertoni, Director, Education, Workforce, and Income Security, Government Accountability Office. I welcome both of you and thank you for being here. Mr. Weaver, please go ahead. You're recognized.
Chairman Johnson, Ranking Member Becerra, and members of the subcommittee, thank you for inviting me to discuss the complexity of statutory rules for returning to work and overpayments due to work in the Disability Insurance, or DI, program. I am David Weaver, Associate Commissioner for Research, Demonstration, and Employment Support at the Social Security Administration. Social Security is a social insurance program under which workers earn coverage for retirement, survivors, and disability benefits by working and paying Social Security taxes. DI benefits help replace some of the lost earnings for workers who, due to their significant health problems, may no longer be able to work and support their families. Last year, we paid over $140 billion to nearly 11 million DI workers and their family members. In all, 151 million Americans are insured for DI protection. The statutory benefit eligibility requirements are stringent. Disability is the inability to engage in any substantial gainful activity due to a physical or mental impairment that has lasted or is expected to last 1 year or to result in death. In addition, DI benefits are modest. In 2015, disabled workers receive on average less than $1,200 in benefits per month, or less than $14,000 per year, just above the poverty line. Given the strict eligibility criteria, many DI beneficiaries may not be able to return to sustained work. However, we are committed to helping beneficiaries with disabilities who want to attempt to re-enter the workforce through various work incentives established by the Social Security Act. These incentives allow a DI beneficiary to test his or her ability to work without immediately losing cash benefits or medical coverage. For example, the Social Security Act provides for a trial work period under which beneficiaries can work for at least 9 months without losing any cash benefits, regardless of how high their earnings might be during those months. Once the trial work period has expired, the Social Security Act provides for an extended period of eligibility. The Act requires us to pay cash benefits for 3 additional months, even if the DI beneficiary continues to work and earn above a certain level. After these 3 months, the Social Security Act requires us to pay cash benefits to a DI beneficiary for any month in a 3-year period if earnings fall below a certain level. The statute provides that at or after the 37th month of the extended period of eligibility, cash benefits are terminated if a DI beneficiary continues to earn above a certain amount, although the beneficiary will continue to receive Medicare for several more years. For 5 years after termination of cash benefits, a beneficiary is generally eligible for the expedited reinstatement period to the DI beneficiary rolls if he or she is unable to continue working at a certain level. Many DI beneficiaries often need medical devices or unique services that facilitate their ability to work. Accordingly, the Social Security Act requires us to exclude from earnings any out-of-pocket costs for items or services that a beneficiary needs to work, which are called impairment-related work expenses. We're also required to consider whether a DI beneficiary is receiving subsidies or other special conditions to support his or her work. These incentives are depicted in this chart that was mentioned earlier. As you can see, the statutory work incentives are complex, and our beneficiaries, many of whom have very serious conditions, often find them difficult to navigate. Earnings may or may not lead to the loss of DI benefits depending on many interrelated factors, including how much is earned when work is performed, and whether some earnings must be discounted because they paid for impairment-related work expenses or their earnings are subsidized. The situation becomes even more complicated considering that many DI beneficiaries are also entitled to supplemental security income, which has a different set of statutory work incentives, shown in this chart. Given this complexity, evaluating a DI beneficiary's work is one of our most resource-intensive administrative workloads. Even with better data and better tools at our disposal, we cannot simply rely on numbers that are reported to us. We must follow up with beneficiaries and their employers to evaluate work activity. These reviews take time and resources. That said, we are excellent stewards of the Social Security DI program. We estimate the 5-year average amount of overpayments due to work with is less than 1% of benefit payments. However, we continually to strive to improve efforts to prevent overpayments. My written testimony describes how we inform beneficiaries to promptly report work activity and our more recent efforts to improve program integrity. In addition, we would support congressional action to renew our demonstration authority to test new ways to simplify work incentives and encourage more disability beneficiaries to work. As policy changes are considered, we stand ready to help evaluate changes to our programs and how they would affect our DI beneficiaries. SSA and Congress have established a complex set of work rules to encourage beneficiaries to work, but this is balanced with a shared interest in program integrity and stewardship that requires limitations or reductions in benefits as people re-enter the workforce. We'd very much like to work with you to simplify these rules, but we're also aware that there can be winners and losers, and we must proceed with caution to avoid unintended consequences. Thank you for allowing me the opportunity to testify today. I'd be happy to answer your questions.
Thank you. Thank you for being with us. We do need to simplify and change. Mr. Bottoni, welcome. Please proceed.
Chairman Johnson, Ranking Member Becerra, members of the subcommittee, good afternoon. I'm pleased to discuss the Social Security Administration's efforts to address disability insurance program work activity and resulting overpayments. Last year, SSA paid about 11 million beneficiaries and their families over $140 billion in benefits and identified $1.3 billion in overpayments. To ensure that beneficiaries remain eligible for benefits, SSA requires prompt reporting of their work activity, including starting a job or a change in wages. If a beneficiary does not report as required, or SSA doesn't properly process such information, the agency may pay benefits in excess of what is due, resulting in an overpayment. Avoiding overpayments is important, as they pose a burden to those who must repay excess benefits and waste taxpayer dollars when they can't be recovered. They may also create a disincentive to beneficiaries who might otherwise wish to work. My statement is based on our ongoing work for this subcommittee and discusses what is known about work-related overpayments and factors affecting the processing of beneficiary work reports. In summary, over the last decade, $11 billion in overpayments were paid to beneficiaries with work and earnings that exceeded program limits, with about 96,000 beneficiaries annually incurring an average overpayment of about $12,000. Moreover, over the last several years, SSA attributes a significant portion of overpayments to its not taking timely and appropriate action to adjust payments when notified of beneficiaries' work activity. We identified several factors that affect SSA's timely handling of work reports and increases the risk of overpayments, even when beneficiaries try to follow program rules and report work and earnings as required. First, we identified process weaknesses that could result in staff not issuing a critical receipt that proves a beneficiary's work activity was reported per program rules. Such receipts are also critical to promptly processing work reports and adjusting beneficiary payments to minimize the chance of overpayments. And second, while SSA requires staff to timely record and investigate reported work activity, it lacks procedures detailing the steps they must take in screening reports to determine whether further investigation is warranted, and for ensuring they are processed and closed out with appropriate action. In fact, at several locations, we didn't identify any agency processes to assess the accuracy or quality of screening decisions, or to provide feedback to staff on how to improve work report processing. And absent better controls, there is a risk that a report could be improperly closed and the beneficiary overpaid. SSA also lacks automated reporting options similar to those in its Supplemental Security Income Program. For example, SSA recipients can report work and wages through an automated telephone reporting system and a smartphone application, which allow for more prompt action in processing such reports. Excuse me. Although deemed effective for the SSI program, the agency has cited complex DI program rules and an unclear return on investment as a reason for not pursuing these tools for both programs. However, this conclusion was based on only a limited evaluation of the costs and benefits of using these reporting options for DI program beneficiaries. In the meantime, SSA's current manual process remains vulnerable to error and can result in long wait times for those who try to report work activity. And finally, we have long reported that the DI program has complex and sometimes confusing work incentive rules for both beneficiaries and agency staff to understand. During our current field work, we found that staff had varying interpretations of program rules for when beneficiaries should report work and earnings, and that the direction they provided beneficiaries could lead to overpayments. And despite the importance of informing beneficiaries of their reporting responsibilities, we found that SSA provides only infrequent reminders via its forms and communications with beneficiaries, and those that it does provide contain limited information. Once again, this is in contrast to the SSI program, where the agency employs various electronic and web-based reminders for recipients to report work and earnings. As you are aware, our work is still ongoing, and we will continue to build on the findings discussed today. As such, we will continue to work closely with SSA and the subcommittee in developing recommendations to address the policies and procedures that pose a risk to both beneficiaries and taxpayers alike. Mr. Chairman, this concludes my statement. I'm happy to answer any questions you may have. Thank you.
Thank you. I appreciate your testimony. I wonder how you keep track of every office, which is where those reports go into. How do you?
It's all up here.
I think that's part of the problem.
Not up there, not up there.
As is customary for each round of questions, I'll limit my time to 5 minutes and ask my colleagues to also limit their questioning time to 5 minutes. Dr. Weaver, on the screen is a chart provided by you on all the rules a disability beneficiary needs to deal with if they're working or looking to get back to work. I don't know how beneficiaries can make sense of all that. Can you?
It is definitely complicated. I think, you know, when we talk about our disabled population, you're talking about individuals who suffered something terrible and health impairment. They often have financial conditions, so we know that the population is dealing with a lot of issues. And a process like this is, to them, often is viewed as complicated. So we do agree that the rules that have been built over time, they have the intention is to make it safe to return to work, but there's an issue of whether the complexity has become too much. One of the things we do try to help our beneficiaries with is not just to give notices or reminders to them about the work rules, but we support a large number of partners. About 500,000 of our beneficiaries are either working with a state VR agency or an employment network under the Ticket to Work program. Another 40,000 are working with community-based work incentive planning assistance organizations or protection and advocacy organizations. So it is complicated. In some cases, the best way to deal with that is for the beneficiary to get help from one of our partners.
Well, the question I have is, how can a Social Security office determine whether the guy deserves it continually or not? And, you know, you can't count on the guy telling you, hey, I'm okay now, I'm working. They're not doing that. With all these rules, how in the world is someone supposed to know if they ought to be getting disability still, or if Social Security's even made a mistake and the individual's racking up overpayments that they may have to pay back? Let's assume that a person does everything right. They tell Social Security they're making money, they're following all the rules. If that's the case and they receive an overpayment, is that person still responsible for the overpayment or to tell them about it?
It is possible the person is still responsible for the overpayment. The waiver requirements are in the Act, and we've built policy and regulations around them. But generally it depends, as a rule, if the person's without fault and if they have the resources to pay us back. But it is possible somebody reported timely.
Well, do you go after it?
We do try to collect the overpayment.
Repayments?
Yes. We try.
When you say try, what do you mean?
Well, we have to work with the beneficiary to determine whether they can pay the money back. So we look at whether their income is sufficient to cover their day-to-day living expenses.
But if they're making any income at all, do they still deserve the disability payment?
I think you can make a case they deserve it. I think the issue is that we're required to collect overpayments. We do take account of the beneficiary's circumstances, and if they have limited income or resources, we can sometimes waive the overpayment.
Do you have any idea how much in overpayments you've recovered in a year? That's okay.
I may have to get back with you.
Well, if you look at that chart, I'm not sure it's working the way that Congress intended for it to work. Social Security has offices all over the country managing the program, and we hear a lot about how Social Security needs more money to administer the program. Now, your testimony states that work CDRs are one of your most resource-intensive administrative workloads due to the complexity of the incentive program. Do you think it would reduce administrative costs to simplify work incentives or even centralizing the work instead of spreading it all over the country?
I think it's possible that changes in the law to simplify the programs could reduce the administrative burden. I think you'd have to look at that carefully in terms of how it affected the beneficiaries. But I do think there's certainly possible policies that would reduce the complexity and lower the administrative.
How many workers do you have working on CDRs?
We do about 250,000 CDRs per year. I'd have to get you the figure on how many workers support that workload. I did want to thank you. Your question about the how much do we collect in overpayments. So in last fiscal year, we collected about $900 million, recovered $900 million in overpayments in the DI program.
Do you know what the total overpayment was?
Work-related overpayments. I'll have to get you that figure.
Okay. Mr. Bottoni, shouldn't this process be simplified and improved? And in doing so, wouldn't it help beneficiaries and also help Social Security save on administrative costs?
I would say, first, last year, work-related overpayments were about $1.3 billion, so that's where they were last year. As far as saving administrative costs, I would defer to the agency. They probably looked into this, but no doubt that processing and following up on thousands of work reports annually is a huge workload and a very costly workload. Administrative simplification, simplifying the program, could in fact result in some cost savings. But it all comes down, the devil's in the implementation details. What you choose to simplify, how you get there is going to drive where your savings end up. There are some changes that could in fact result in administrative savings, but at the end of the day it could result in more benefit outlays. But if you have a less complex program, less error-prone program, a program that's less vulnerable to fraud and abuse, that's a trade-off. So it really comes down to how you design it, what you choose to simplify, and what your goal is.
Have you thought about it? I'm sure you have. You talk about it. Can you help us simplify the program?
There are aspects of the program that clearly don't make sense, and there are options out there to do that. I think that the best source for you to go to would be the folks that administer this program. I think you need to work closely with SSA. They know this program front and back. We certainly can evaluate these options and give you criteria by which to evaluate them, but I have no specific model that I would pursue.
Thank you, sir. Mr. Becerra, you recognize. You want to see if that works?
Yeah, I think it works now. Thank you, Mr. Chairman. Thank you for your testimony. I think what your testimony highlights to me is that this is one tough job to try to administer in terms of making sure it's being used for the right reasons, but at the same time making sure it's available, because a lot of these folks have qualified for their disability. They have no obligation to try to go out there and work. For the 1/4 of all these disability recipients who try to work, what they're saying to us is, hey, I'm so disabled, I qualify to receive the benefits, but they're still saying, but let me see if I can go out there and work. I think what we want to say to them is, go for it. We want you to succeed. The difficulty is the balance between providing them with the protections, because the last thing we want to do is say, go out there and try to find a job, and they land a job, and they succeed at it for 25 days, but we've cut off their benefits because now they're working, and after day 26, they no longer have a job. Now they have nothing, and I think we would give them a disincentive to try to find work if we told them, you found work, that's it. We're going to cut you off. Of course, that means that we have to run the risk that somebody finds work and works and works and works and now is doing fairly well, but hasn't informed SSA, the Social Security Administration, that they're now working well and they may not need the disability benefits at the level they have. And so that's the tough part, is we want to go after those folks who start to game the system. At the same time, we want to give every American who's disabled the incentive to believe I can still get out there and do work. having said that, Mr. Weaver, Mr. Bertoni, please, if you have anything you'd like to shed on this, are there any of these protections that we've provided that you think we can undo as part of simplification? So, for example, we tell a Social Security disability recipient, go out and find work. If you find work for several months, we're still going to pay you your benefits, even though we know you're working, but we're still going to pay you the benefits until longer term we see that you're going to sustain yourself. Should we get rid of that incentive?
Sure. Let me offer a few comments without advocating a particular policy. I think if you just took the work incentives away, it would harm our beneficiaries. So the issue is, what do you put in place, or what do you keep? I think one of the things that confuses our beneficiaries is the number of periods we have in the law. And so when we tell our beneficiaries, well, there's a period where you can have 9 trial work months and a 60-month average, 60-month period, and it has no effect on your benefits. And then you get in the extended period of eligibility. If you earn above another amount, it does cease your benefits, but we may be able to restart them. And then there are other periods. I think that
You've already confused me.
Yeah, it's hard to say that in words. So I think, and for people who are struggling with a lot of issues, as our population is, so I think the issue is, can you find some alternative that's protective of beneficiaries but is simpler? And a lot of, again, not to endorse any particular proposal, but there are proposals out there that look at benefit offset formulas, make it more of a formula. You could have, we had an idea for a demonstration proposal a few years ago, and it's not a current one, but under that proposal, you'd have very simple rules that if the person earns above substantial gainful activity, which is about $1,000 and $1,090 a month, they wouldn't get paid a benefit. If they earn below, they do get paid a benefit. We don't terminate them. They don't have to go through all these periods. So kind of rule-based things may help. Again, not advocating any.
So where we can, try to streamline it so it's clear for the person who's
Right.
trying to work. I know you have a project. It's called the Work Incentive Simplification Pilot, where you're going to try to see if you can figure out a way to simplify things. But you're calling it a pilot project. It's not, you're not just implementing it full blown right away. Is that because
No.
you want to test it, see if it works?
Right. So it's not an official pilot at this point. It was in the 2012 President's budget, but it's not. So we don't want to put everything in what we call the Work Incentive Simplification Pilot. We are interested in working with Congress on, are there particular incentives we could test? You're right. And so you'd want to test it before you put it in the program to see if it improved things such as lowering the administrative burden, whether it encourage people to return to work.
Chairman, I think it would be helpful next time we have a hearing on this to have someone who could speak from the beneficiary, that disabled American's perspective, so that we can get a sense from them what they think works, doesn't work, where are the complications, the complexities for them to navigate the process. Most of these folks would tell you they're trying to do the right thing. Part of the problem is the delays that they incur in getting a hearing to get this settled. I know that the wait time is over a year now to have an administrative law judge hear their case, and I don't think any American wants to deprive an American who worked and is now disabled the chance to receive the proper benefits that they've paid into. You mentioned, I think, was it Mr. Weaver or Mr. Bertoni? Mr. Bertoni, I think you mentioned there are 250,000. Is it the
Work CDRs.
Work CDRs? And CDRs, again, are, for those who...
Continuing disability reviews.
So these are the cases that you're looking at in the event that there may be something going on in them.
That's correct. And those are complicated workloads. If we don't get a timely report from the beneficiary, we do enforcement actions where we receive data from the IRS that is posted to our earnings file.
Right.
And
So
then,
that's a red flag that's gone up saying to you, we got to take a look at this
Right.
person's file to make sure that they're receiving the benefits they deserve.
that's right. And at that point, you have to employ this whole chart, but retrospectively, because it's after the fact.
Yeah, so
Um,
you're,
so
not only do you have the complexity of the chart, but if I did my math correctly, if you have 250,000 of these cases, it sounds like a lot, but when you have 64 million people who are receiving benefits under Social Security, that translates into, if my math is correct, less than 0.5%. So more than 99% of Americans who are receiving their benefits under Social Security aren't part of this. But we still want to make sure that we're only giving benefits to those who've earned them. So I think, Mr. Chairman, this is where we have to go. I think we all agree on a bipartisan basis. We got to figure this out, because whether it's because of the delays, because of the bureaucracy, that we're not getting to these overpayments quickly enough, or it's because someone happens to be trying to game the system, we want to go after those folks, because at the end of the day, what we want is a program that actually does encourage people to work if they can. I mean, I want to give any American who's disabled who says, I can still work, let me show you that opportunity to do so. So I appreciate your testimony, Mr. Chairman. I think this is one of those areas where we're probably going to have to delve into it quite a bit, because it sounds to me like you got to shepherd these things a lot. You're never going to come up with some real simplistic formula to determine someone who can and cannot work, or is not receiving benefits they deserve. It's going to be a lot of investigative work, and there's where I think if we do more to provide the resources so you get through those CDRs quickly, we'll be able to process this in the right way for Americans who have paid into Social Security. With that, Mr. Chairman, I'll yield back.
You ready to fill out your form for a job?
I hope for a while I still don't have to worry about that, Mr. Chairman.
Mr. Young, you're recognized.
Thank you, Mr. Chairman, for holding this hearing, and I thank both of our witnesses for mastering the details of this chart and others, so that we can be better informed and craft better public policies. You know, I'm very confident that together in a bipartisan way or nonpartisan way, we can make meaningful improvements to how these programs are administered, and we want to be a partner in that and working with you and others and the beneficiary community as well. In the end, this comes down to capability deprivation, the deprivation of capabilities that results from, in some instances, a flawed work reporting process, which leads to overpayments, which can exacerbate the return to work. And we want people to go back to work because most people want to work if able to do so. And so this is about empowerment. I'm confident we can do this. I used to be a management consultant. We'd go into organizations. We would flow chart stuff out. We would look for opportunities to automate and reduce some of these different boxes where they existed. And very frequently there were, we called them COTS, commercial off-the-shelf technologies, that had worked under in one environment for one purpose in one enterprise and could be modified to also work in another enterprise, similarly situated one that perhaps provides similar services. I see a similar opportunity here. It's not something I've conceived of, but others have discussed this, and that's looking to Social Security, the means-tested SSI, the Supplemental Security Income Program. They have a mobile app and also an automated phone system, unlike the disability program. And so I guess my first question would be, why can't we make these automated set of tools available to and adapted to the needs of SSDI and recipients?
Sure. Thank you for the question. I think one of the things we found, I mean, we're highly motivated to have technology that solves these problems. When we looked at the SSI program, we did have more to work with in terms of policy complexity and structure. So in the SSI program, there isn't a trial work period or an extended period of eligibility. Earnings have an effect on cash payments through a formula. That is, if you earn above a certain amount, $65 a month, each $2 of earnings reduces $1 of the SSI amount. So it lent itself to a more direct technology where somebody could input their wages and we could seamlessly put that through our systems to compute a payment. On the DI side, I think some of the things we struggled with are that it depends on where you are in the structure about how earnings affect your benefits. But I take your point about the improvements in technology, but I think some of it was driven by the complexity of the DI program in particular.
So is it your belief that perhaps, at least for a subset of the disability recipient population, adaptation of existing technologies may be one of the options we pursue?
I'd have to reflect on that. It may be for a subpopulation that system would work, but I'd have to give it a little more thought.
Okay.
Mr. Young, I think I could touch that a little bit. We think that the agency should be looking at those alternative technologies, and perhaps they're looking at it a bit differently than we are. I understand that there's complexities associated with the DI program. There's a different level and multiple levels of additional layers that you have to dig down into to determine whether there's a work CR should be ordered. But these apps, and as well as the telephone reporting system, do a couple things. The first thing they do is to give the beneficiaries a couple more avenues to report wages and earnings, and hopefully in a timely way to prevent an overpayment, if not that, to reduce the overpayment. So there's a use there. So there's some value there. Second thing they do is they address this long-standing problem of no receipt. If you don't have a receipt in this program and you get an overpayment, the receipt proves that you reported work activity. And if you have a receipt, that's how you can get the waiver.
So bottom line is, you think this is worthy of pursuing. You think it could conceivably work, so I'll just put a period there because I sense that's a fair summary.
I
Can
think
you
it needs
nod
to be
affirmatively?
vetted fully before they kick it to the curb, yes.
Okay, and then finally, perhaps you could just answer this very directly. It's my understanding when Social Security shifted towards an automated system, there were a number of work years that were saved. Could you quantify those work years to maybe give us a sense of the potential with respect to DI and our ability to save work years?
That I can't. I would have to defer to the agency on that.
Is the agency, is that something you could answer, Mr. Weaver?
The work year savings from the SSI telephone, let us try to get you an answer for that. And the issue is how much in work year savings we have because of the SSI telephone technology.
Thank you both.
Sure.
Mr. Doggett, you recognize.
Thank you very much. Mr. Bertoni, I'm a big fan of the GAO. I think that y'all have been very helpful and are getting accountability from all parts of the bureaucracy. I have requested a number of reports, and I've never gotten one before that is entitled Preliminary Observations. I guess this is an unusual situation, not unprecedented, that you come forward and give us your observations before your work is complete.
Correct.
Normally, when I've worked with GAO, there's been a preliminary report. The agency's given a month to respond and comment, and then it comes to us. When there's a reference here on page 2 to the fact that Social Security has not responded yet, when did they get this report?
They got the report 2 days probably before the Hill got the report.
2 days before today?
Just to
Sure.
explain that, we had almost no time to do this hearing. It was
I
very
understand
tight.
it was a
So
rush,
we-
and
yeah.
it's,
So
it's important for us to get your observations, but I understand you're not to the point, you're identifying some of these problems, but you're not to a point of being able to recommend to us
correct.
what we should do about them.
Yeah. This is they're
And-
preliminary. These are findings that we have been able to fact check.
They
and
could
believe
change
are
to
correct.
some extent in the future.
Yes.
And we look forward to hearing from you as you finalize it. And certainly with reference, Commissioner, to the Social Security Administration, I think our concern, my concern at least, is that we address the problems that GAO has found, but do it in a way that the cure is not worse than the problem we're trying to solve. We, of course, unfortunately don't have any disability recipients here today or any of the advocates for those groups, but it's pretty clear that people that have qualified have gone through the very difficult process of becoming Social Security disability recipients are people that have serious problems, and yet they go back and they try to work, and that if we impede those work incentive programs, we will have done great damage to them as well as to the overall goal of trying to ensure that everyone who can work does work.
Sure, I do agree with that. The work incentives do provide protection for our beneficiaries. They have serious health problems. 1 in 5 are in poverty. So again, I think the issue is, are there policies that are protective, possible improvements? But I take your point that the work incentives do serve individuals now, and it benefits them. So you have to think carefully about what the alternative would be.
And we could get ourselves in a situation if any changes are not done very carefully, where somebody who is severely disabled, who qualified to receive benefits, and with the best of motives goes out and tries to work anyway, could end up with nothing, where they can't work and they lose their Social Security disability benefits and they're left penniless. Isn't that a danger?
That could be a danger, and I think in my earlier remarks, what I wanted to offer was that in addition to demonstrations which take longer, we're ready to help this subcommittee look at options with data we have things can turn around faster than demonstrations, but we do want to help provide information that would allow you to evaluate policy and make sure the most vulnerable members of our society are not harmed.
And while I don't believe that there is any part of our government that could not be searching for greater efficiencies to be sure every tax dollar is well spent, isn't it true that over the last 3 or 4 years, Social Security has received on average $1 billion less a year than it needed to do its work, and has lost almost 5,000 employees around the country to address the charge given to see that Social Security is available to those with disabilities and our seniors and our survivors?
Yeah, I'll note that you're right. The figure of 5,000 losses is the most recent one. At one point, we had losses of 11,000 employees.
Right.
Better budgets have allowed us to fix that to some extent. But if we enter another period where we have to lose a lot of employees, you lose institutional knowledge. It's hard to recover from those things.
Well, I want to thank both of you for your testimony. I think it's really important we try to make the changes necessary to address the problems that have been identified, but do it in a way that, if in doubt, we protect the rights of some of our most severely disabled neighbors to continue to be able to have an incentive for work and to have the dignity of some protection. And that overall we give meaning to the Social Security Act, and I hope we can get a markup in here eventually of Mr. Becerra's bill on Social Security fraud, so that we can address those issues by adequately funding the agency. We know that for every dollar we invest there, the taxpayers would gain significantly. Thank you very much. Thank you, Mr. Chairman.
Thank you, Mr. Kelly. You're recognized.
Thank you, Mr. Chairman, and both our witnesses, thank you for being here. I just want to make sure that I understand, because you hit some figures early on, Dr. Weaver, about the amount of payments that we're talking about. Would you tell me again the number of recipients and the dollar amount?
So I think one question earlier was, what are the overpayments? And I think Mr. Bertoni mentioned that some of the numbers they have there, about 1.3 billion per year.
3 billion overpayments. But the total amounts that we spend or that we pay, what are the total benefits that are paid out? Do you know? Just ballpark it for me.
I think about $700 billion if you're counting.
700 billion.
If you're counting the old age and
Oh,
survivors.
I'm counting it all. I mean, because it's a large number.
Right.
The budget for your agency.
700 or 800 billion. Our budget is.
Excuse me, did you 700 or 800 billion?
Right.
Okay.
Those are just ballpark. I can make.
Yeah, listen, and I don't want to be disrespectful, but there's a hell of a difference between 700 billion, 800 billion.
Sure.
Especially when it's taxpayer funded. So I mean, it's not chump change. Tell me about the size of your agency, the number of people.
We have approximately 60 to 65,000 employees.
65,000. And your budget amount for the year to run it?
I think it's approximately $11 billion.
Okay, so 65,000 people, $11 billion. Okay. And all those funds that we're distributing, where do they come from?
They come from payroll taxes.
Payroll taxes. So people who are working, right?
Correct.
Okay. I know we're talking today about overpayments and everything else, but where I am from, there's quite a few people on Social Security, and I get that. Honestly, we work with GAO to try and streamline this to get to the point where we're being the most effective and efficient agency we can be, and that we're truly serving the needs of those that are disabled and really need that help. I get that. I really get that. I just don't know, when I hear the numbers that you're talking about, these are incredible numbers. So how many people receive, totally, how many people get some type of a benefit each month? How many Americans?
I think counting all of our Social Security programs and the SSI program, it's approximately 64 million.
64
million.
Million. And our total population is about 300 million? Boy, that's a heavy load. So I guess it comes down to, so you want to get more effective, you want to get more efficient. Believe me, I'm not out to get you. I'm out to make sure we're working as effectively and efficiently as we can. But when you talk about those numbers, it is almost incomprehensible to me that this program is on a path that we can actually look at and think, you know what, I think things are going to be all right if we just streamline it a little bit.
So I think it's a good comment, and this came up earlier, that The work incentive proposals apply, or work incentive rules apply to just the DI population or the SSI population. Most of our disability beneficiaries, because of their health, the large majority have absolutely no earnings, and that's true of the SSI program. So I agree this is a subset of the issue, and it's not the global issues facing the programs.
Yeah, it's just, Mr. Portoy, GAO, I mean, you're always working to make it more effective, more efficient. How often are you able to get together to talk about how we could make it better? Are you able to share that data? Are you able to go back and forth?
Yes, in a typical engagement, we're back and forth with SSA, talking about the issues, the problems, their proposed solutions. This whole issue with the app and with the telephone wage reporting, we've had multiple meetings with them. I've got 8-page documents where we've Q&A'd them and really trying to get behind their logic, their thinking, as to why they don't want to move forward with this. So yes, we do, and periodically we meet to talk about sort of high-risk issues, their efforts to modernize their programs. We meet a few times a year. And from an oversight standpoint, that's my job. And it's a big agency. There's a lot going on there, but I think they're productive meetings.
Yeah, I just think that the American people, and I mean this sincerely, have no idea of the size and scope of these problems. And as we move forward, the dollars it's going to take to continue on the path we're on, it's totally unsustainable in my way of thinking. But I'm only coming from the private sector, so I've never had the ability to borrow money at whatever amount I needed. But I do want to. I think Mr. Becerra is right. We need to work with you, and somehow all of us getting together to make sure that we can have a program that's truly sustainable, and we don't penalize people. As I have people back home that, when it comes to reporting, it's so difficult for them, and they want to go back to work, and they're not sure if they go back to work, if it's worse for them by going back to work than staying in SSI disability. So we got to make sure we make it easier for them. So I really appreciate you being here.
If you have the mechanisms in place where they can report and know that they're not going to get a letter in the mail saying they owe $20,000.
See, that's the problem.
That's key to someone's willingness to step out and go to work.
Yeah, I've got a gal that's been in a wheelchair because a drunk driver hit her. She just got tagged with a $74,000 payback on it. There's no way in heck. She tutors people on the side to make a few extra dollars. They said, well, you're making too much money. Now you're going to have to pay back $74,000. What she gets now is enough to cover her living expenses. So, I mean, this is hard, and this is really hard for people who get hit with this. Not the people that the maybes out there and the anecdotal things we know, but I'm talking about real American people facing real problems. You get that bill from the government that says you owe us $74 grand because we overpaid you. That is one hell of a note to get in the mail, and that scares the living daylights out of these folks.
Gentleman's time has expired. Mr. Renassi, you're recognized.
Thank you, Mr. Chairman. I want to thank the gentleman for being here. According to Social Security Administration, 27% of overpayment dollars were the result of cases where the SSA received a notice of work activity but failed to take appropriate or timely action to adjust the payment. Now, I will tell you that percentage is down, so I know you're working to move that number down, but 27% is still a big number. I know it was as high as 53%. So, again, I commend you for the work you've done to bring the number down. I'm just trying to get an understanding of how that happens. So, Dr. Weaver, can you tell me how long does it take Social Security to identify an overpayment when a beneficiary reports his or her earnings? And how big is that overpayment on average?
I'll have to respond. We'll respond with you for the specific numbers. I think your general point, what happens is sometimes if a beneficiary doesn't report timely or if we don't act on it timely and it reaches the enforcement action stage, it is a much tougher case, and the overpayments can be substantial in those situations.
So do you have any idea how long that time is? How long does
Well,
it
for
take?
example, when we do an enforcement action and we do a work continuing disability review, I think the average processing time may be 250 days.
Wow. So again, you would agree that the longer it gets down the road, the tougher it is.
I agree, and let me mention one of the things. One of the things where we think we have some success in moving the dollar amounts and have had a good bit of success is we've employed statistical models that when we get alerts from the IRS posted to our earnings files, these statistical models predict which cases are likely to be large overpayments and will get out of hand if we don't act on them immediately. Our Inspector General looked at sort of that business process and some of the things we've done in the last few years, and it did have a big effect on lowering the average overpayment in the sample they were looking at from about $18,000 to $8,000. So one of the things that definitely matters is getting to the enforcement action closer to when the earnings actually happened. The longer delays, you're going to get large overpayments. Very difficult to reconstruct history of what happened. A lot of aggravation for our beneficiaries, and we often have to contact employers to get information to administer these rules.
Mr. Bertoni, how does this happen in your eyes, and why can't Social Security move a little quicker?
I think the source of some of this is that the wage data that the agency uses. When they get the alert, when they get the information, that alert is based on IRS data that can be up to 2 years old. So that person could have been incurring, working 2 years ago. They're just finding out about it. Some of these, now it goes into sort of the hopper to be worked. And we reported a couple years ago, cases can sit there 12, 15 months before they're worked because of the backlog. Then they go through a process of being worked. The 207 days is a goal. We had a range of up to 900 and something days. So that's a long, extended period where the clock is ticking. That person has been receiving benefits they shouldn't. And ultimately, that's a pretty large overpayment to recover.
So
getting timely wage data is important. Using alternative databases like the National Director of New Hires, the alternative means of reporting wages and wage information and work. The agency needs to move forward and explore them more fervently.
Because you've just indicated it could take up to 2 years to get adequate or accurate information. So what are some of the things that can be done? What are some of the ways we can help you fix that? I mean, everybody always talks about more money and more personnel. Believe me, I came from the private sector, as Mr. Kelly did. You have to work with the budget you have, and in many cases, that means you got to do things more efficient. So what are some of the things you can do?
Their enforcement operation is like 80% of all CDRs, and that is consolidated across, I believe, 8 processing centers. They tend to use the older IRS wage data. There is, if the information comes in from an individual, they can use other tools. They can use the wage reporting tools. They can use National Director of New Hire data, which is quarterly data. We've recommended, and I believe the agency has acknowledged the value of going to the NDNH, National Directory of New Hires, that has quarterly data. I think if you go to more timely data sources, it stops the clock from running at an earlier time, and you're going to have smaller overpayments.
Thank you. I do think we need to be able to work together in a bipartisan fashion to make this work better, because 27% overpayment, again, the American people are looking at this and saying, we got to make things work, and the dollar's got to be there for those that really need it. So I appreciate your work in getting this number down, but we got to get it down much lower. So, Mr. Chairman, I yield back.
Thank you. Mr. Brady, you're recognized.
Mr. Chairman, thanks for having me back to the subcommittee. Couple thoughts. One, this is frustrating, not this administration, by the way. It's just been frustrating to be able to get people, reward people for getting back to work, and through the years, as we've held hearings, the frustration continues to grow. We've got some pretty good incentives in place. The 9 months trial work program with full benefits, 3 years safety net on your income, up to 8 years nearly for the Medicare or the healthcare side of it, really important when you're disabled. Seems to me we've got some pretty adequate benefits in place to help people transition. Yet today we hear about the overpayments and the improper payments. And Mr. Bertoni, I was curious, one of the points you made was that on self-reporting, which I'm not sure that's the way we ought to be going, by the way, in this whole system. I'm not sure the honor system in a complicated process is the heart of it, which it is in this case. But so why wouldn't someone get a receipt if someone is self-reporting? Why does SSA? I mean, why is that even a question?
Really depends on what mode you use. If you call into the telephone wage reporting system, or you use the app, there's no human involvement there. You're going to get an automatic receipt. So that to me, that's a good thing.
And what percentage use that?
I don't know, but it's a pretty significant number over the last couple of years. I think they had 40,000 in September, multiplied by 12, something like that. So it's a good amount. I believe it's growing. So you have that mode. Now, if I walk into an office, or I fax or mail my work report into an office, now the report is received. The receiving staff person has 5 days to get that entered into the system. It's a manual process, and get that, and then mail you a receipt. People are busy, and we have a manual process. There's other workloads. Things get put aside. So that's where it can break down, where the receipt may at times not be mailed out to the person.
So that's really sort of a lose-lose both for SSA in tracking these, but also for it leaves someone vulnerable.
They have a
you know,
5-day
clearly.
goal, but there's really no way to track it with any effectiveness. So it's pretty much as a metric in holding people accountable. It's a paper tiger.
Why are we self-reporting? It just seems to me, someone trying to get back to work, whether they're self-employed or most likely working for someone who's reporting, why, even more often than quarterly, why couldn't a beneficiary who's trying to get back to work, couldn't they voluntarily provide the approval to send monthly income reports or make them available to the Social Security Administration? Couldn't we create a crosswalk for both the beneficiary, Treasury, and SSA in these areas?
I guess I'll mention two things in this area. There are a couple of proposals in the President's budget. One is for quarterly reporting of earnings. SSA processes about 220 million W-2s, and those are annual figures. So one proposal is if we could get earnings reported quarterly. There are a lot of issues that might improve things on, but that would get us the information more quickly. We do have another proposal in the President's budget there are commercial databases that payroll providers that work with employers. They have the earnings. One of our proposals is to get the authority to have data agreements with those where we can get access to the commercial databases. So it's more real-time data that the employer has provided to this payroll service provider. So that's another possibility.
So
that's
what do you need to go forward? Both of those seem reasonable, approaches. So why not move forward with those?
I think both of those would require new authority for us to enter into.
Is that the only thing holding you back? Authority from Congress to put those in place or try them?
I think that's correct, but
you're seeing vigorous head nodding behind you, so I'm assuming the answer is not yes, but heck
that's
yes.
correct.
Well, it seems to me that's an area where both our member and ranking member probably have a lot of interest in. We certainly would. We want to help people get back to work. Clearly, self-reporting just seems to me a big weakness in this process, and there just seems to me there could be a solution that helps people do exactly that, especially the workplace. Technology is allowing people to work who've never been able to work before. Not as many of our jobs are ditch digging. They're knowledge-based. We've got more adaptive of a workplace than we've ever had, frankly, in America. So it seems like, it's just a ripe environment to sort of make a huge change in helping people who want to get back to work, get back to work.
And I agree about the third-party verification. I think the self-reporting aspect is just complementary to what they should be and are doing in other areas. The enforcement operation does a number of data cross-matches to try to find unreported wages. And even the persons that are reporting through those self-reported mechanisms would conceivably be swept up in that third-party data match. So these are, I think, complementary, where individuals who want to report and want to report timely have a venue, and the organization also has third-party data sets that they can tap into to get the folks who aren't reporting on their own.
And what do you think that would do to lower the overpayments? What's the impact, do you think, in real life?
I think, I don't know what the numeric value is, but I think having more avenues for self-reporting as well as third-party verification in a timely way, it works. It works across the board in other programs. It works at SSA when they do it right. It's just, again, it comes down to implementation and how frequently you're doing it.
Got it. Chairman, thank you very much for holding this hearing.
You're welcome. Mr. Reed, you're recognized.
Thank you, Mr. Chairman, and thank you to the witnesses. Very interested in the testimony today and working together on this important issue in regards to disability trust fund and the emphasis on work and having assistance available for individuals who have the capacity and desire to return to work. So let me challenge the administration a little bit, the Social Security Administration Office a little bit. What is your understanding as the stated purpose of the Disability Trust Fund?
Stated purpose of the trust fund is so we can make scheduled payments that are outlined under law to individuals on our programs.
See, that's part of the issue I have with SSA, because what I'm hearing from folks in the community and back in the district across the country is a potential cultural issue with the SSA office when it comes to disability trust fund. Because I noticed in your response you didn't say anything about work. I didn't see anything in the material talking about that as part of the disability trust fund is making sure the administration is promoting and encouraging work. And that to me is an issue. And I think we can do better on that front, because we have a whole body of law, in my opinion, the American with Disabilities Act, and we have come so far with the disability community. I was a mayor. I promoted the Vital Link, which is to link our entire community in my city to access, to make accessible to people with disability, Main Street, our grocery stores, our pharmacies. And one of the things I'm seeing in the disability trust fund arena is a conflict with that half of, if not half, but that purpose of the federal law, whereas the disability trust fund seems to say, we're just going to give you money, and that's it. And that's what I just heard from your response to my question. So the question I have for you on top of that is, what is the standard operating procedure for Social Security Administration to discuss with applicants the work incentive program? When do you do that?
We do a number of things. So when they are awarded benefits, we provide information on how we can support them while they're working.
Is this the Red Book, this thing?
That is one of the publications we have.
So do you sit down and go through this with the beneficiary?
No.
No.
And
and if I could, it says here, we try to keep the Red Book clear and brief. We follow plain language guidelines, etc. Right? That's the stated purpose of this book. I just randomly picked some pages as I was preparing for the hearing today. And I'll go to one, my favorite here. What is the EPE? Oh, the EPE begins the month after the trial work period, TWP, ends. If you're not working that month, the first 36 months of the EPE is the re-entitlement period. I got 11 older brothers and sisters, and I sit around the Thanksgiving table, and this is plain language, according to the Social Security Administration. This is not the language we use around the Thanksgiving table. Can you tell me how that's developed, how this language is developed?
I think the language is complicated because the structure is complicated. We really do try to make our publications plain language, and the Red Book is actually pretty well received in the VR community. And
how about for beneficiaries?
I wanted to mention that our best way of supporting beneficiaries is through our employment support programs. So we tell beneficiaries that we'll provide free services. They can get free services through state VR or employment networks in our Ticket to Work program.
So you actually use state VR to beneficiaries? Do you think a beneficiary knows what a VR is?
No, I don't, but what we do is we provide information on the employment support programs, and there's a special call center we run, and we provide notices and other information to beneficiaries.
So what I hear there, Dr.
call
Weaver, in that response is, that's really not our job. That's someone else's job. That's the VR's job to do. What I'm hearing from you in your testimony today is that the best resource that we have available to beneficiaries who want to return to work is not from the administration, but from some third-party outside group. Do you think that's the best practice we could do on the federal government level?
I respectfully, I do think it is part of a good practice. I think the VRs and the employment networks and the work incentive planning and assistance organizations can work really closely with these beneficiaries to explain the rules, make sure they report their earnings, and not only that, but help them get back to work. So individuals who are beneficiaries who are in VR or working with Employment Network actually do have pretty good outcomes under our program. They're also sort of a way that they can help explain the rules. So it's not all on the third party, but I think those individuals are good partners and they serve our beneficiaries.
And I appreciate the work the VRs do. Don't get me wrong here. I think they do yeoman's work in regards to this issue, and I applaud them. But one of the concerns I have is the cultural effect that beneficiaries have walking into the administration office. And if the administration's office goal, as you stated on your original response to the question, is to provide the benefit to individuals, how do we change that culture of the Social Security Administration to say we're going to be a partner with you, not only to get you the benefit, which we all agree we want to do, but we want to encourage you, if you have a willingness and a desire to get back to work, not only are we going to put you with the VR community, the Social Security Administration is going to take responsibility and be a true partner with you in regards to this issue. Is that something you think the Social Security Administration can accomplish?
I think we can be a key part to that. And I failed to mention that within Social Security we do have individuals who are area work incentive coordinators, and within the field we have work incentive liaisons. But we do not message that we value work, and if a beneficiary is interested in work, we want to both communicate that at our offices, but also to make them aware of partners who can help.
I appreciate that, and maybe we can do a little better on the red book in that language as we go forward. And I meant my words in a constructive way, to work with you, because I think there's a lot of bipartisan agreement and people in the community that want to come together on this issue, like myself. And I look forward to working with you. I'm going to continue to challenge you, and that's not meant in a negative way. That's meant to be in a positive way. With that, I yield back.
Thank you, Mr. Reed. Mr. Becerra, you're recognized for 5 seconds.
Thank you for all those protections, Mr. Chairman.
Time's up.
Actually, Mr. Brady brought up something that I thought was, I think it goes to the heart of where I think we're going to really have to work with you, and that is, if we let people voluntarily, what was it, the voluntary ID, where you self-report work and earnings. You self-report what you're doing. That definitely will streamline things. But, Mr. Bertoni, wouldn't you agree that the more we allow people to self-report, which will help us do things faster, we also take the chance that there's going to be someone who is in that group that self-reports who wants to game the system, because now I'm just self-reporting. You're not checking on me. Now I might get away with it. And so it's a balance, right?
Well, self-reporting in this regard with the telephone reporting system in the app is someone calling up and saying, "I'm working." Okay, that's a red flag that you need to take a look at my benefits. So they're actually, in a way, they're flagging work. Now, might they, because it's self-reported, report some incorrect information about earnings and that? And yes, that it's not verified, so you can have that issue. But I doubt it's the report of work is incorrect. So at least we have a report of work that is worthy of a receipt. So down the road, should something happen, your SSA doesn't work that in a timely manner, a $10,000 overpayment pops up, the person gets levied an overpayment, at least they have the receipt to prove that they've did what they were supposed to do. And that's one of the two elements they need to get a waiver. So again, this might not be the do-all, be-all, end-all, but it does serve some purpose.
Yeah. And let me try one last question to you. So I think that because of what you said, if it helps us get more accurate reporting and gets people to do the work, that's good. But if there is someone who tries to game the system, that's where, Mr. Chairman, I think we have to descend on that person, make that person an example. So we want to encourage folks to want to self-report. But the moment you think you can game the system, we want the system to just descend on you in such ways that you're going to pay a big price. So someone says, whoa, I'm going to self-report, and I better do it right, because I don't want to be the next guy who pays a price for thinking I can game the system.
If you're gaming the system, you're not reporting. So their enforcement operation.
Or you're reporting inaccurately.
Yeah, I guess wages inaccurately. Yes, okay. But the enforcement operation through the various runs ultimately should catch up to you. If they're doing it correctly and in timely, and we don't have a CDR backlog and all that stuff. But so it's sort of a double barrel effect. You can catch sort of the folks who want to do it the right thing, catch the folks who are gaming the system through the back end data matching. So I think, again, these are complementary. No one thing is going to solve this problem.
Thank you, both of you, for your testimony. Thank you, Mr. Chairman, for the extra time.
Thank you, and I want to thank the witnesses for your testimony. And we're committed to finding ways to make the program work better and promote opportunity for individuals who want to return to work. Today's hearing looked at one of the problems, only one. But there is more that can be done. That's why Chairman Ryan and Chairman Hatch and I will be launching a website to gather ideas from all Americans on ways to improve and strengthen the disability program. And I encourage all of you to share your ideas with us. With that, I think the hearing has been beneficial to all of us, and I thank you for being here and look forward to working with you and all my colleagues, and including the ranking member. And thank you again for being here and trying to help our guys return to work. With that, the subcommittee stands adjourned. Thank you.